Ontario is among the wealthiest jurisdictions in the world, and yet 1 in 10 people in this province, including 1 in 6 children, confronts food insecurity every day. Joining us now to look at the cost and challenge of hunger in Ontario, Valerie Tarasuk. She is a professor of nutritional sciences at the University of Toronto. Sylvia Miracle, Executive Director of the Ontario Federation of Indigenous Friendship Centres. Darren Thorne, Adjunct Professor at Osgoode Hall Law School. Michael Taube, syndicated columnist for Troy Media and a contributor to the Washington Times. And Supriya Dwivedi, national columnist with the Toronto Sun. And I want to welcome everybody back here. You four, we recognize all too well. This is your first time here, Valerie. Lovely to have you here. Here's what you have said. You have said households that rely on social assistance or employment insurance are at very high risk of food insecurity. But it is important to recognize that almost 2/3 of food insecure households in this country are reliant on employment incomes. How is it possible that so many people in Canada are working but still are not able to make ends meet? We're going to explore that. Let's start with how you define food insecurity to begin with. What does it mean?
Okay. It's uncertain or inadequate access to food because of financial constraints. So the way that we assess it in Canada is through a very, very detailed measure that ranges from people worrying about running out of food and not being able to buy more because they don't have money, through to people describing compromising the quality of their food intake or their children's food intake because of a lack of money to buy better food. And at its most extreme levels, people describing actually not eating, going hungry without eating, going whole days without eating in some cases because of a lack of money for food. So it's very significant compromises that occur in the context of financial constraints.
Darren, how is it possible to be working in this country, to be making money in this country, and yet not having enough to eat?
I think it is frighteningly easily possible for that to happen in today's day and age. And I think it speaks to the dimensions of poverty in Canada, which are more than we tend to think. I mean, the statistics are that 1 in 7 people in Canada is actually living in poverty. And of that, the other statistics are some 60 to 70% are actually the ones that are working. So, you know, this goes well beyond what we tend to think of in terms of poverty. We tend to think that poverty is associated with those few who are not working, but that's actually just, in many cases, not the case. The rise of the working poor is a really disturbing phenomenon. As to why this might be, if you actually look at the way that our economy has changed, we moved away from a manufacturing economy, and the type of jobs that are on offer now seem to be changing. Part-time jobs, precarious work, temporary work, those kind of jobs are on the rise. Add to that the fact that if you're working full-time and you're making the minimum wage, you're really going to be making only about $22,000 a year. And I don't think anyone needs me to tell them that, you know, in cities or elsewhere, that is just not a lot of money to go on.
That does not go very far. Supriya, let me read this excerpt from the Canadian Medical Association Journal. I'll get you to comment on it. Once again, Valerie, this is you pointing out that the prevalence of household food insecurity in Ontario has not changed significantly in recent years. Furthermore, Ontario has one of the lowest rates of food insecurity in Canada at 11.7% in the year 2012. Is that any reason to celebrate, do you think?
No, absolutely not. I mean, you mentioned it right off the bat. Ontario is one of the richest jurisdictions in the world. So I think if we're celebrating that we're not the worst, that's not exactly something to write home about. Earlier you said 1 in 6 children, 1 in 10, is essentially a little bit over 1 in 10 if it's 11.7%. That's just simply, if there's enough to go around, which there is, as citizens, as taxpayers, as residents, as people, we shouldn't be standing for this. And I think, the face of poverty, as Darren mentioned, we have these perceptions of what that should look like, and increasingly it's changing. Increasingly, it's not what we necessarily think it to be, and we need to adapt our perceptions and get to a place where we're actually trying to solve a problem.
Sylvia, the Canadian Community Health Surveys that provided the data for Valerie's paper excluded individuals living on First Nations reserves. So let's ask you about the food insecurity picture on Ontario reserves.
I would argue that a number of efforts over a period of time have stopped people from doing traditional hunting and gathering activities that they were doing because M&R wants to control those things. And
Ministry of Natural Resources.
Excuse me, yes. And they take your boat and they take your gun and they take whatever, and you can't afford those and you can't already have afforded food, so what are you going to do? There aren't a lot of food banks in First Nations communities, And the thing I think that worries me most is where there's no road access. But the nature of poverty is that a car and gas money to town, where the grocery store is, if there is one, if there's a road, is a cost. And I think the last factor for me about this is that I want to use an example. The government subsidizes liquor. It's the same amount of money in Pickle Lake as it is in, on Front Street in Toronto, because they're in the business of providing it. But they don't subsidize food. And so in our communities, people are paying for things that conditioning has taught us to eat, store-bought bread and milk, and you're talking about things being $12, $18 for a carton of milk. I mean, on and on and on, and so people simply can't afford that. They go without.
We've done programs, Michael, on the fact that the cost of everything, but certainly food, in places north of Steeles here in Toronto can be frighteningly out of hand for a lot of people. True. But do you have any ideas or thoughts about how to improve this situation in particularly far-flung places in the province?
The one thing about food insecurity is obviously we're talking about the consumption of food and healthy, nutritious food, but it also has to go with the amount of money you can make to actually purchase that food, because as we know, junk food is a lot less expensive and more readily accessible. So I think in that case where you can help are education programs, training programs, and other things to sort of guide them along and move them in a direction where they can get better jobs, better skills, and improve their lives. The private sector is a bit more of an intriguing issue, because for them, we always look at the bottom line, or most people who believe in the private sector look at it that way. So they might say, well, if I'm not getting enough of a tax credit, why am I going to help in a certain situation? But I think one thing we have seen quite a lot of is that, for example, banks like TD Bank, RBC, and others have actually helped with programs such as for hunger, for food, etc. So they are willing to help and guide in certain ways. Now, the remote locations, there's only so much we can really do, because obviously, if you're not close to a huge town, it's a very difficult issue, and you can't just suddenly say, well, you all have to leave, change your geography, change your lifestyle, change your history,
What about
etc.
Sylvia's idea, though, of subsidizing food?
Subsidizing could work in certain cases, and I certainly think maybe, for example, in reserves or in rural areas, I think you might actually have an example where it might work nicely. I just think that the balance between the public and the private sector, and maybe a triple P if you want a private-public partnership, maybe that would be a way to actually benefit society so that food insecurity turns into food security.
I want us to, well, before we look east, we're going to look up, because I want you to look at the monitors here. We're going to put a chart up here and look east. This is Newfoundland and Labrador. This is the food insecurity issue in this place. And apparently they have somehow managed to reduce the percentage of people on social assistance who were food insecure from nearly 60%, which you see in the top left-hand corner of that graph, to just over a third. And Valerie, I guess we need to understand, how did they do that?
Well, they increased the rates. So they started by increasing the incomes. Then they indexed them to inflation, which is hugely important. I mean, this talk about food that we've just had and food prices, there's practically no benefit that anybody gets except seniors in this country that is indexed. So Newfoundland indexed its welfare rates to inflation. They increased the liquid asset exemptions, so people didn't have to be absolutely penniless in order to qualify for social assistance. They increased the earnings exemptions, so people were able, even if they could get just a small bit of work, they were able to keep more of that money. I mean, typically provinces claw back earnings from people on social assistance. So Newfoundland was more generous there. So I've named four things: the rates, the indexation, the liquid assets, the earnings exemption. That's just the beginning. They also improved health care benefits. They did what they could figure out to do to improve people's access to affordable housing. So it's a cascade of interventions that spread over that period where you see that very sharp decline in food insecurity.
Look up again. We're going to put another chart up down. This time, we're going to compare Newfoundland and Labrador with the province of Ontario. Now, we traditionally think of Newfoundland and Labrador as one of the less well-off provinces and ours as one of the richer provinces. And yet, look at this. Food insecurity among households reporting income from social assistance, and there's the province of Ontario, up near 60%. Darren, does that make any sense to you?
Not a whole lot. If you take a look at that, you start to think that maybe we better start casting our eyes towards Newfoundland to see exactly what they did, or look at maybe some other measures that can be used to try and reduce poverty and food insecurity generally. I'll throw out one idea which is currently being considered. It's questionable whether or not this is a good one, and maybe we can talk about that down the line. But we heard about it in the Ontario budget. Quebec is apparently looking into this as well, and there are calls for the federal government to establish a pilot project. And what I'm talking about is the idea of a guaranteed annual income. Canada essentially establishes a guaranteed minimum income that anyone who's an adult living in the country would be entitled to. So I guess the idea would be we do away with a lot of the programs we currently have. So EI, welfare, housing benefits, those programs would be done away with. The government would then take the money and would be able to top up the income of people who are making less than this minimum level. And the minimum level presumably would be set essentially at the poverty line. So it's a fairly dramatic idea.
And simpler.
Very much simpler.
Much simpler.
Very much simpler. And there's probably, if you look at the statistics, it's likely to impact food insecurity in a positive way because we have a program somewhat like that in the sense of our old age programs.
I want to get Michael Taub's opinion on this because, of course, they tried it in Manitoba in the 1970s, and it worked. So, needless to say, they got rid of it. That was the one time it was tried. They are going to try it, a pilot program here in the province of Ontario, as announced, as Darren said in the last budget. As a conservative, what do you think of the idea of a guaranteed annual income?
The day that I support nanny statism is the day you will never have me on this program again. It is not something I support by nature. Certainly, I recognize that people are in need, and if they need help or assistance, we have EI, we have public health care, we have various things that can help people in life. Anybody, even a small C conservative like myself, would support something like that. The guaranteed income, and I know it's been tried obviously in Scandinavia, and as you said, the example of Manitoba as well, there are some instances of it. I think it becomes almost a little too simple in its strategy. The assumption that everything gets locked under this one thing and then it's delivered to you or you have to pick it up or it's directly deposited into your account, well, people say that sounds wonderful. Others will also think of it, unfortunately we've seen it also in Scandinavia, as free money, that it's all basically there. Sure, we're paying for it and we're paying for it with our tax dollars. So we know what it is and we know what it's going to be and we know what the amount will be and where the threshold will eventually be. To me, it's always a very big risk when you actually increase or enhance the state's role in something like that. I always believe in devolving and actually helping people, as I sort of said earlier, with education, training, and ways to give themselves sort of a hand up, which is why I've always, for example, opposed welfare and supported workfare, because you don't want to give them a hand up, you want to give them just a way to actually improve their lives and become better citizens.
In a way, wouldn't you be actually lessening the role of the state if you are in fact replacing, multiple other programs with one more efficient program? Doesn't that end up being fiscally much more efficient and actually has less state intervention?
If that's the way it actually is done. Now, I know what they're suggesting, and obviously that's the model that they're presenting right now. The question then is, are they going to continue with that model? Like, it's easy to say that everything is going to be done, we're going to eradicate all these other programs, and everything is going to be situated behind one program. Unfortunately, the nature of government is always to give things that sound really nice, but when the end result comes in, and that's the issue I really have with this, Supriya, I don't think it's going to be like that. Right. Because someone's going to start saying, well, yeah, it's nice that we get a few thousand a month or a few thousand a year, and we have a bit of a way to help ourselves around it. But what if we need more? Shouldn't we go back to these old programs that we eliminated previously? And I think that's always a risk.
Yeah, it's interesting. I'm a little agnostic on this idea myself, because it is a major change, and I recognize functionally there would be difficulties in implementing this. I would say I agree with Supriya that in some ways this seems to be a fundamentally conservative idea. I mean, we often hear of politicians saying we need to reduce the role of government, we need to eliminate government, we need to put the money in the hands of the people, and then they can do with it what they will. Well, this seems to be exactly what this program would do. So it's one of these scenarios where I think the rubber sort of hits the road with respect to these programs. But I do recognize that there are some real functional problems in terms of implementing this.
Sure, but on the issue, Sylvia, of food insecurity, which is one of the things it would presumably be designed to attack, do you think it might work?
I do. And so one of the things that I think food banks is the tip of the iceberg is there's an awful lot more congregate dining in our community, that we offer meals for children who come after school. Meals, not snacks. We offer meals for women who come with their babies to programs. We offer meals for seniors. They're not, we're talking about indexing, but there's not a basic level having been created here. And so if it hasn't worked, why do we tinker with it? Why don't we try something else? We're not going to make it worse if we're trying to guarantee a level that all human beings really should have, and we certainly have the resources to do it here.
Valerie, let me follow up with you again on this issue of food insecurity. The food banks are, if you'll forgive the expression, in business in this country to attempt to do something about food insecurity. How good a job are they doing at that?
I think they're doing the best job they can. But it's an important question for people to think about. The number of people using food banks at any point in time is a mere fraction of the number of people who are food insecure. By our best estimate, over 4 million Canadians are living in food insecure situations. And that doesn't include people living on reserves or people who are literally homeless. So 4 million is an underestimate. But that is more than 4 times the number of people showing up at a food bank any month, according to Food Banks Canada's reports. So we've done other research in Toronto, looking more deeply at how come people don't use food banks and how many don't use food banks. And what we can say is that for every person who uses a food bank in a community, there are probably 5 others who are struggling to feed themselves and their children. And those people who receive food assistance in that brief moment when they are able to get it are very, very unlikely to have had any change in their food insecurity status. So it's a small fraction. It's a gross over-representation or misrepresentation of the problem, and there is absolutely no evidence that it turns people from food insecure to food secure. So perhaps this is going off on a tangent you don't want to go on, but I think earlier there was a conversation here about the role of the state. I think it's very important to inspect the role of the state vis-a-vis this problem and to think about the role of the state relative to what we've had in place in Canada now for more than 30 years, which is food banks. I mean, the state has relied on food charity as a way to manage this problem. Food charity is the public face of the problem, and for that we need to be thankful because at least they keep it visible. But beyond that, we've got a terrible problem on our hands, and we can debate whether basic income is a good idea or a bad idea, but what is the role of the state relative to food insecurity?
Okay, I got to go back to Tobe on that. Do you think the state has a role in making sure that its citizens aren't hungry?
The state certainly has a role to play. I would never say that you eradicate the role. Just because I personally prefer the private sector over the public sector doesn't mean that government doesn't have a role to play. Like Sylvia discusses about food banks, and as Valerie did as well, they are very important to society, and no one is saying eradicate them. If anything, I think we should look at ways to actually improve them or enhance them. The issue that I always have and the concern I always have is when we say government is not only just the solution, it's the final solution. To me, that actually limits the whole playing field, and I think you have to keep looking to outside sources to help. Compassionate conservatism, one of the things they did to actually discuss in the United States and in parts of Canada was about charity, was about food, was about hunger, ways to actually intervene and help private sector companies, churches, synagogues, mosques, and others get involved. There are lots of different avenues that I think that we can actually use in that instance. Food banks are very important and we have to keep them alive, but there are other ways to do it.
Supriya, it feels though, if I'm reading between the lines properly of Valerie's comments, that the government has in essence contracted out its responsibility, to the extent that it has one, to keep people from going hungry, and they've contracted that out to food banks. Is that acceptable?
No, I don't think it is, especially when you look at the results. If you were talking on the beginning of the program, if we had much better numbers here, then I would say maybe. But considering it's not working, I think we need to go back to the drawing board and we need to ask ourselves, if you have a government and one in a jurisdiction as rich as Ontario, and you have so many of us that are going to bed hungry, I think we have to ask ourselves, is this the kind of society we want to be? And I don't think it is, and I don't think even conservatives would say that it is.
No. Darren.
Yeah, I mean, I think that's an excellent point. I also think it kind of begs the question, at the end of the day, what is government for? I mean, we all pay our resources into government. Presumably, part of the reason that we do that is so the government can be an entity which structures society in such a way that everyone has at least a chance to succeed. So I think stepping away from that, and certainly I don't think it's solely government's responsibility. I mean, you get help where you can, and you improve certainly where you can, and you get assistance where you can. But to allow government to evade its responsibilities by pushing this off on other institutions is problematic, because that's essentially the idea of why we actually have a government. Otherwise, we're left in a situation where it's those with less are looking to those with more for charity. And we've spent a couple of hundred years trying to get away from that model.
I want to throw some numbers at you here, and even though you're a long way from being a senior citizen, I want to ask you about senior citizens. Senior citizens apparently in 2015 saw a big increase in the numbers using food banks in this province. And one would have thought that given all of the income support programs for seniors that have been developed over the years, over decades, that wouldn't be the case. So I wonder whether that surprises you.
No, it doesn't. I mean, also the population continues to age. I mean, there have been horrific vacillations in food costs because of natural events all around the world. Indeed. In terms of where it comes from. And, sure. And you know, I mean, wasn't a cauliflower one time 99 cents and then it was $6 or $7? I mean,
more. Exactly.
Yeah, exactly. I think there are transportation issues, and I think an answer to some food insecurity is some places need roads and transportation. And it can be a private sector. I'm not suggesting, I can tell you the people who come into the friendship centers, the Indigenous friendship centers that I work with, would be much happier to get food vouchers to go to their local grocer, if there was one in the town, and have a reciprocal arrangement. And we sometimes can go in a few of those places and say, can you give us a 10% benefit if we're going to get these? People feel empowered and more proud that they're not ashamed, and there aren't the rules about you can go to this food bank only this many times. I think there are lots of things. I think seniors are caught up in all of that, and increasingly, as you know, people don't leave seniors' homes, which means that seniors have to feed other people who are absolutely not the ones numbering in the numbers going to the food bank or caring for grandchildren.
Valerie, I want you to make this connection for us, if you would. Food insecurity, healthcare costs in the country. What's the connection?
Oh, the connection is huge. When you asked me at the beginning of this program the definition of food insecurity, and I said that we've got a range of severity. So last year we did a piece of work looking at healthcare costs in Ontario in relationship to healthcare, in relationship to food insecurity. And what we found is that adults in Ontario, and this was just like over a 12-month period, an adult in Ontario who is in a food insecure situation will burn up systematically more healthcare dollars than a food secure adult, moving in a graded fashion depending on the severity of their food insecurity. So those in the most severe situation are, in the course of a 12-month period, on average, burning up more than double the healthcare dollars of someone who's food secure.
For example, because if you are food insecure, you are looking at what kinds of chronic conditions?
All kinds. One of the things that I want to clarify here, I mean, a lot of this conversation has revolved around the issue of food and food prices and food access. And one of the things to clarify is that the longer that we've done research in this area, the more we've realized that while we identify people as food insecure by asking them about their ability to feed themselves and their families, as we scratch the surface and look at their conditions, we think that this food insecurity is really a marker of material deprivation. By the time somebody is struggling to put food on the table, they've got all kinds of struggles. They're behind in their rent, they're not paying their bills. If they have chronic diseases, as most people who are food insecure do, or most adults, they're very unlikely to be filling their prescriptions or filling them properly because they're struggling to make ends meet. And unless they're on social assistance, they probably don't have drug coverage. So there's a cascade of disadvantage in the household that we identify as food insecure. So when you start to translate that into these findings around healthcare costs, someone who's in that circumstance is struggling very, very hard to try to manage. So the stress is enormous, and trying to make ends meet in those circumstances is a full-time job. Whatever conditions they've got, they're less able to manage. So any chronic condition they've already been diagnosed with, be that a mental health condition or a physical health condition, will erode.
Let's see if the corollary is equally true, meaning that if food security goes away, does your health improve?
Well, we believe the answer to that should be yes.
What do you mean we believe? We don't know?
Well, we only have a few places in Canada where we've seen food insecurity drop, right? Those social assistance recipients in Newfoundland are very special for us because for us that's very, very hard evidence.
Great test case.
Problem is sensitive to policy intervention, and that group can be changed. But sadly, Newfoundland and Labrador don't have the luxury of the kind of healthcare tracking system that we have in Ontario with the Institute for Clinical clinical and evaluative sciences. So, once we found that effect in Newfoundland and Labrador, we headed out there thinking, okay, we want to look at your healthcare data. And they said, well, we don't exactly have that kind of data, so we can't help you there. So everything we know about the relationship between food insecurity and health would say that if you improve food insecurity, you will improve health. And you'll improve it both in the sense that you will enable people who are struggling with chronic diseases to manage them better, so they're less likely to turn up in an emergency department or wherever. But the other thing you'll do is prevent or lessen the likelihood of the onset of new conditions like depression or diabetes, other sorts of conditions that there is some evidence are more likely to manifest in somebody who's chronically food insecure.
Supriya, I got to tell you, about 30 years ago, when food banks sort of first came on the scene in Ontario, listen, we all know the guy. Gerard Kennedy was the head of the Daily Bread Food Bank in Toronto and was a master at getting attention for this issue. And then food banks kind of became part of the landscape here, and what was supposed to be temporary has become permanent, and we don't pay that much attention to them anymore, certainly not as much as we did back in the day. So if you're going to give advice to people who are seized of this issue and want to give it some added prominence to deal with everything we've been talking about here today, what would you say?
So you're asking me to solve the problem? Is
Is
this what it is?
Let's hear it.
In the next 3 minutes, yes.
Well, I think, first of all, having discussions like this, I think, is first and foremost important, because I don't think your average person on the street would think that so many Ontarians are suffering from food insecurity and are afflicted with it. So I think the more we talk about it, I think the more we're talking about tangible solutions, whether that's guaranteed minimum income, or whether that's public-private partnerships, or whether it's kind of going down the route of some European nations, like France, for example, has now legislated that grocery stores have to, in fact, donate any unsold food to food banks, and they have to enter into a contract in order to do that. I know in the States, for example, Starbucks is entering into a pilot program where they're going to start donating all unsold food that they have there. So these are the sort of things that I think the more we push into the fore, and the more they become less policy discussions and more water cooler discussions and more conversations around dinner tables. I think that's how you get that sort of thing out of, and no offense to academics anywhere, but that's how you get it out of an academic paper and more into an actual everyday paper.
Did you take offense at that? I'm just curious.
Deeply.
Okay.
I just want to challenge all this conversation about public-private partnerships. I want to go back to the point that Darren made at the very beginning here, which is that, and that you made in your introduction. Most people who are food insecure are in the workforce. So they have an employer. That's the private sector responsibility on this, right? I mean, we can talk about Starbucks doing, donations, or some food store making donations, but what I'd like to see is a company, whether it's a food sector company or another one, step forward and say, we're going to be a food secure employer. Because all these people who are food insecure, or at least 2/3 of them, have an employer, at least one, possibly several.
So what would that entail?
Well, I think it might entail taking a good hard look at wages and hours to make sure that people that you employ have sufficient access to employment income through the hours, so we're not chipping away at jobs to avoid having to pay benefits by turning all of our employees into part-time, short-term workers. So we don't offer people job security, we don't offer them benefits, and those people are maybe getting 10 hours here, 10 hours somewhere else, and some weeks not even 10 hours. So I think when we talk about the private sector, it's our natural instinct, it seems, particularly around food, is to go into this talk about philanthropy, and now, sadly, we've elevated that one more step by talking about the disposal of food waste to food charities, as if somehow that's part of the solution. But I think, if we step back and get at the root cause, these people are working. And so to have employers step forward now and say, we're going to take a look at our workforce and make sure that we design the employment we have to offer to ensure that it enables people to feed themselves.
So is that increasing the minimum wage? Is that necessarily?
It may be increasing a minimum wage, but that's an issue that I think deflects attention from the real problem, which is the one that you described earlier, Darren, in terms of precarious work.
The gig economy.
That people working short-term, part-time hours, and a family of 4 trying to survive on one earner's salary, or maybe a couple of people working part-time. Those are very significant problems. And if we step back and talk about the private sector as having a role here, which I think it truly does, I just feel like it's really important that we name the role of the private sector as an employer.
Having said that, the minimum wage is going up again in October. We've got a new system in place in Ontario where it goes up automatically every year. It doesn't have to you don't have to have a new debate every 3 years in the legislature on what to do about it. Do you anticipate that would make any kind of dent in this problem when the minimum wage goes up in October?
Will it make a difference? It might make a minor difference. It'll make something of a difference, but there's a difference between a minimum wage and a living wage. And we're seeing that, just to give some context, California just this past week has decided to go to a minimum wage of $15 an hour US to try and get to something close to a living wage. Ours right now is $11.25. Canadian. And it's going to be increasing. It's going to be jumping to $11.40, which is more of a hop than a jump. If you think about it, that is 15 cents an hour. So by my math, that's $1.20 a day, $6 a week, $24 a month. I'll stop doing math now. But the point is that at the end of the day, $24 a month, yes, if you're living in poverty, certainly every little bit helps. But realistically, how much of a dent is that going to make? I think if we're assuming a lot, we're stretching it.
Let me get Sylvia on that. Minimum wage going up October, will it do more than make a dent?
Well, first we have to have jobs.
Right.
So,
you got to have a job before you can get minimum wage.
That's right, before you get minimum
Gotcha.
wage. But I'm not convinced that that the wage we're at, as Darren has suggested, is a living wage. And I think we have to have a conversation. So we can constantly move by 15 or 20%, but if it was never a level playing field when we started, we're never going to catch up. I think there's some old style things that we should do.
Like what?
Like people should grow food. Every school in all of the province should have a community garden where we learn to share. I mean, I grew up in a community that was poor, but food was not what we were insecure about. Old people put food away, they dried it, they shared it, they taught you how to grow it, how to cook it, we don't have any of those kind of interactive things. Families don't even sit and have meals. That's why fast food becomes so attractive. You can do, and I think that we've got to change too.
We do have rules though about, particularly if you live in an apartment building or a condominium in a big city, even if there's a roof garden, you're going to have a tough time convincing people they should be allowed to grow something there.
But on the other hand, we're so upset about bees. We can keep bees, like I need the bees to pollinate so we can have the food, but I need the food too, right? We all live together here. We're all connected, and it seems to me that there's a disconnect, and I think it's a big disconnect that has. Not only from family values, and I find myself using that word in a peculiar way, from a notion of having a collective of people who worked together, who ate together, who looked out for each other, to having a government, disempowered people, whether you like it or not the term, and have created the space and then have dropped the space. And now we're expected to come back together again. And we're going to do it again, probably through nonprofits, which we're not really supporting. And we're not giving dignity, if I can use that expression, to people's situations so they can hold their head up and feel like they're part.
Can I follow up on that? That's a great point. And Valerie, I'll go to you on that. I have heard in the past, and you can tell me if it's still true, that a lot of people who are food insecure will not go to a food bank because they are afraid of losing their dignity. They do not want their neighbors or their friends to see them at a food bank. Is that true?
Yes, I think it is. But I push back and say, but so what? Since when was it? We don't have any data to suggest if they did go to a food bank, it would shift that curve you just showed us, or it would change these healthcare dollars. So if they go or if they don't go, frankly, a few years ago we did an extensive study looking at people who used food banks in Toronto, and we couldn't see any effect of the use of the food bank on those people's dietary intakes. Why not? Because it was literally a drop in the bucket. Because food banks are donor-driven, voluntary organizations, their operation effectively boils down to rationing what they've received in terms of donations. So if you did suck up your pride and go because you absolutely were desperate and needed help, you would receive a very carefully metered out bag of food, or maybe a couple of bags of food, depending on the stock that the place you went to had. But whatever it is, it'll be a far cry from what you really need, and it won't help you to pay those other bills you're in arrears on. And depending on the rules of the place, you may or may not be allowed to come back again before next month. So I think, we can get whipped up in talking about, well, there are problems because people don't feel comfortable receiving charity. Well, of course not. In an affluent society like ours, of course they don't. But dignity means being able to practice consumer behaviors like the rest of us.
Let's hope we can have this discussion again in a year or two and see much lower numbers. Thanks, everybody, for this. Appreciate it very much.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.